Greetings, everybody. Welcome to the National Academy of Medicine webinar on accelerating healthcare decarbonization. Now, this is first in a series of webinars on building momentum to act on healthcare decarbonization. There's a policy and leadership stream, and there's a healthcare delivery stream for clinicians. Thank you for joining us today. My name is Hardeep Singh. I'm a quality and safety researcher and a general internist in Houston. I represent the VA on the National Academy of Medicine Climate Collaborative. I'm joined today by a dream team, I think, of organizations and their representatives that are doing a lot of influential work in this space over the last few years. So we have today with us Aparna Bole from the Office of Climate Change and Health Equity from the Department of Health and Human Services. We have Kevin Zacharyasz from the Joint Commission. And then we have Michael de la Guardia from the CMS Innovation Center. I'm going to be a moderator. I'm going to kick us off, and then we'll have a moderated question and answer session after some presentations from our panelists. So just a quick reminder of why we are here today. So about 4.6% of emissions globally come from healthcare. And you might think, well, that's a pretty small number, but that's almost twice that of aviation. Where are these emissions coming from? As you can see, we do a lot of activities in healthcare. So if you look at these three buckets in front of you, four actually, there's the blue bucket, which is probably the largest. 80%, 75, 80% of the emissions are coming from things that are related to our supply chain, pharmaceuticals, medical devices and other products, transport. There's a lot of waste. And so there's a lot of things we can do in healthcare to promote environmental sustainability, to reduce pollution, and then to also reduce waste. So what's our call to action? There's several reasons why we need to do this. This is from a National Academy of Medicine paper on a call to action on decarbonization, why people should care about this topic, out of which some are listed here and then can get us started. So I'm going to turn it now to Dr. Bole from the Office of Climate Change, who's going to talk us through some of the initiatives that they'll be working on. Aparna?
Thank you, Hardeep, and glad to be here for this kickoff of this really important series. I am going to spend just a few minutes describing what HHS has been up to in the space of stimulating and supporting decarbonization, emissions reduction in the health sector. And just by way of additional background, I'm a pediatrician by training and practice, and have come from a background of managing healthcare sustainability in my pre-federal life. So I'll ask you to go to the next slide, please. So just a few highlights here. HHS has been engaged in collaborative efforts with federal partners and with the private sector to stimulate and support health sector decarbonization. For example, the White House Health Sector Climate Pledge that was launched a few years ago is a voluntary commitment for participating organizations to align their climate commitments with those that federal health systems and federal facilities are engaging with. And so that pledge includes commitments to reduce organizational emissions by 50% by 2030 and achieve net zero by 2050, and to publicly account for progress towards this goal, to designate an executive level lead for work on reducing emissions, and to conduct an inventory of scope 3 emissions or supply chain emissions predominantly is what we mean by scope 3. And third, to develop and release a climate resilience plan that specifically anticipates the needs of groups who are at disproportionate risk of climate related health harms. When we look at the sum total of pledge signees, in addition to government or federal facilities that are engaged in similar commitments, that represents about 15% of the nation's hospitals. And we have recently completed a survey across the country to sort of account for voluntary commitments and requirements across the country, including state requirements related to emissions reporting. That is going to be the subject of an upcoming paper in NAM Perspectives. I'm really finding that if we add up all of those commitments, there's really a growing momentum in the healthcare delivery space. We're going towards a tipping point where commitments to emissions reduction and publicly reporting toward those goals is really growing in the sector. And so the learning community that we've developed and the partnerships between federal and non-federal entities is supporting and helping to accelerate that movement. So on a related note, we've also convened a federal health systems learning network whose goal has been to accelerate the progress in federal healthcare facilities towards meeting the goals of Executive Order 14057, which is an executive order that commits federal facilities to emissions reduction. And this collaborative also can serve as an exemplar for the private sector in healthcare. Recently, last year, the Federal Health Systems Learning Network announced a shared commitment to clinical decarbonization, drawing on the NAM Climate Collaborative's key actions to reduce greenhouse gas emissions by U.S. hospitals and health systems, and focusing on some of the key topics in those key actions focused on clinical spaces. So reducing emissions related to anesthetic gases, exploring opportunities to reduce emissions related to metered dose inhalers, and reducing physical waste. Next slide, please. We also have hosted what we called a catalytic program to help healthcare organizations understand how to leverage IRA programs and resources to invest in decarbonization and resilience. There are a wealth of resources available from that program on our website, including webinars featuring experts from across the government, including Treasury, EPA, USDA, entities involved in administering these IRA programs, a growing library of case studies describing how healthcare organizations are leveraging IRA resources to improve the return on investment in some of these renewable energy, efficiency, and other projects that can be supported through IRA funds. There are also a few fact sheets that we've developed for specific provider groups, including rural providers, tribal providers. We really had a stated goal to reach safety net organizations in particular through this catalytic program. And just want to also call your attention to a couple of upcoming webinars, one on the Greenhouse Gas Reduction Fund on November 20th at noon Eastern Time, and then another webinar on December 4th focusing on the Environmental Justice Thriving Communities Grantmakers Program. And I will put, it looks like Justin's putting some links in the chat, but I can make sure that there's a link to help you know how to register and link to these resources. Next slide, please. And finally, I know that the focus today is on decarbonization, but of course we know that the relationship between decarbonization and resilience is extensive. The two are really intertwined. And I also just want to share that a new climate resilience for healthcare toolkit will be published as a downloadable PDF in the next month. It will live on NOAA's Climate Resilience Toolkit website. Currently, a toolkit called the Sustainable and Climate Resilient Healthcare Facilities Toolkit that covers healthcare climate resilience lives on that website. It was published about 10 years ago. And so the CR4HC represents kind of the updated, reborn climate resilience toolkit. I should mention that all of the webinars and fact sheets from the catalytic program that I just named, as well as a number of other OCHI's resources supporting health sector decarbonization, are downloadable on our website. And I think that's all I have by way of introduction here. And I will turn to Kevin next.
Thanks, Aparna. Appreciate it. Hi, everyone. Hope you're all having a great day. My name is Kevin Zacharyasz, and I am the Joint Commission's Global Director of Healthcare Sustainability. So I'm really excited to be speaking with you all today and just honored to be on this amazing panel with my colleagues in the industry. Again, thank you to the National Academy of Medicine for organizing today's event. Next slide. So for those of you who might not know us, the Joint Commission was founded in 1951 by the 5 organizations that you see here. So that includes the American College of Surgeons, American College of Physicians, American Medical Association, American Dental Association, and the American Hospital Association. Today, our vision really is, all people always experience the safest, highest quality, best value healthcare across all settings. The work of our enterprise really surrounds hospital and healthcare accreditation, not only in the US, but internationally as well. So next slide, please. So recently we launched the HELP agenda to bring the following elements to the forefront of our vision. That includes health equity, environmental sustainability, learning, and finally, performance integration and improvement. I know we've already heard this fact already, but currently, data suggests that the global healthcare sector contributes anywhere between 4.4 and 5.2% of the world's greenhouse gas emissions. It's incredible to think, but if the sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. These startling facts really led us to start to consider what a certification program would look like. And next slide, please. In January of this year, the Joint Commission launched its Sustainable Healthcare Certification. So the certification provides a foundational framework to really help organizations expand or continue their decarbonization efforts based on reducing greenhouse gases through energy use, purchased electricity, anesthetic gas use, pressurized meter-dosed inhalers, fleet vehicle carbon-based fuel, and waste disposal. Next slide, please. So who's eligible? The Sustainable Healthcare Certification really is a voluntary program available to all hospitals and critical access hospitals in the United States. One thing to note is that Joint Commission hospital accreditation is not required to go through the certification. In addition, the certification is awarded for 2 years, and organizations can apply really as a single hospital site or at the system level. Next slide, please. So what goes into the certification? There are 3 domains or chapters in the program standards, and these standards were developed really by a 22-member technical advisory panel of industry experts, along with literature and guidance documents. Now, the first domain is leadership, which looks at how the organization establishes environmental sustainability as one of its strategic initiatives, including leader oversight of activities to reduce greenhouse gas emissions. The leadership chapter establishes really that sustainability is one of the organization's strategic priorities. And I think at this point, it's well established that commitment to environmental improvements at the executive and governing body levels are really essential to the success of the organization, programs, and initiatives. In addition, resource allocation is really key to supporting the projects and the work, and resources could include anything from financial to equipment to materials to human resources. In the measurement domain, the organization really measures 3 or more sources of greenhouse gas emissions and then converts those measurements into metric tons of carbon dioxide equivalent. As a reminder, those greenhouse gas emission sources are energy use, purchased electricity, anesthetic gas use, pressurized meter-dosed inhalers, fleet vehicle carbon-based fuel, and waste disposal. And then finally, the 3rd domain is performance improvement. So in this domain, we look to see really written goals and action plans to support the reduction of greenhouse gases. We stress the importance of data collection and analysis and tracking progress towards an organization's sustainability goals. Those goals, again, are stated in % reduction in metric tons of carbon dioxide equivalent. You'll notice that we state to analyze your greenhouse gas emission data annually. I would say just as a best management practice to try to update your data as consistently as possible. This will just allow you to analyze that data on a regular basis so that you can adjust your sustainability practices to really meet the needs of your organization. In addition, this also sets you up for success when it comes to justification for both internal project expansion, but also external funding opportunities such as grants or tax incentive programs. Next slide. And so really this just gives that nice kind of summary of the Sustainable Healthcare Certification Program. Again, just thank you all for the opportunity to present today. Here's my contact information if you have any further questions after today's webinar. But with that, I'll turn it over to Michael. Thank you all.
Great, thanks, Kevin. And again, thanks to the National Academy of Medicine for organizing today's event. And As mentioned at the top, I'm Michael Della Guardia. I'm Deputy Director of the Division of Health Plan Innovation at the CMS Innovation Center and co-lead our decarbonization and resilience portfolio at the center. Next slide. So at the CMS Innovation Center, we recently announced the new voluntary decarbonization and resilience initiative to address hospitals' emissions and tackle climate change as one of the biggest threats to our national and global health. This initiative sits within the Transforming Episode Accountability Model, known as the TEAM model for short, which is the Innovation Center's newest episode-based bundled payment model and is open to any hospital selected to participate in TEAM and other hospitals within their health system. So in this slide, I want to cover a bit of the why. We believe that engaging in climate change policy is aligned with the Innovation Center's core mission, which is to test new and innovative payment and delivery system reform models in Medicare and Medicaid with the goal of improving quality and reducing costs. Climate change, driven by greenhouse gas emissions, drives up healthcare costs by worsening patients' health, increasing care needs, and undermining the health system's ability to meet those care needs. In 2018, greenhouse gas emissions from the U.S. health sector contributed to 8.5% of total national greenhouse gas emissions. And we know children, older adults, and low-income communities are disproportionately affected by climate change and pollution, meaning the Medicare, Medicaid, and CHIP programs are more likely to bear the resulting costs. So TEAM was chosen as the first model to incorporate a decarbonization and energy savings element because of CMS's role in paying for hospital infrastructure and operations, and because of hospitals' high level of greenhouse gas emissions. CMS pays for inpatient acute care hospital services, and those payments also account for capital and operating needs. These payments are used by hospitals to maintain and improve facility infrastructure, including energy infrastructure, pay staff, invest in care improvements, and ultimately treat patients. Our decarbonization initiative has the potential to reduce costs to both hospitals and the Medicare program from improved energy efficiency. And one thing I should add is that we are at the CMS Innovation Center, and it's our job and our responsibility to push the envelope and test new ideas for the broader agency. So with that, I'll jump to the next slide and into the details of the initiative itself. So the initiative is comprised of two major elements: a voluntary greenhouse gas emissions reporting system and an opportunity to receive technical assistance and learning system support for participants undertaking decarbonization, energy saving, and waste reducing activities. So the voluntary emissions reporting system focuses on 4 key data types. The first being organizational. These include questions such as whether the hospital or health system has established an executive sustainability team, set decarbonization and energy efficiency goals, or whether they're implementing a decarbonization plan. The next category is building energy and emissions. Here we're using the Energy Star Portfolio Manager system. Hospitals will report their Scope 1 and Scope 2 greenhouse gas emissions data, as well as their facility's Energy Star score, and then related data such as energy source usage data and energy use intensity. The next category is greenhouse gas emissions. Reporting would include total emissions from inhaled anesthetic gases, anesthetic gas purchase records, and a set of questions around decarbonization activities related to this categorical area. And then finally, we have Scope 1 transportation emissions. Entities would be asked to create transportation emissions reduction plans, report on plans to reduce their vehicle fleet emissions, reporting gallons of fuel consumed in their owned or leased vehicle fleet. Taking a step back from the details of the reporting itself, this is the first time ever that HHS will directly collect emissions data from providers and represents a strong step forward in tackling the health sector's footprint. And importantly, in developing this proposal, our team worked hard to align reporting requirements with existing protocols and recommendations from industry thought leaders to address concerns about regulatory burdens on providers. And in particular, we relied heavily on the groundbreaking work by the Joint Commission here with us today, and of course our colleagues in OCHA, the Office of Climate Change and Health Equity, also here with us today. And for team model participants, I'll talk a bit just about some of the incentives in place. So those model participants that choose to voluntarily report this data will share benchmark data that will help participants identify opportunities to improve energy efficiency, lower greenhouse gas emissions, and drive practice transformation. And hospitals that do report will also receive public recognition for reporting, for example, a badge on CMS websites. And in between the proposed and final rule, this was a policy that we set through rulemaking. So we also expanded the initiative to allow what we term hospital corporate affiliates of team participants to also report to the model. So in practice, what that means is if an acute care hospital is selected for the team model, we will allow other hospitals within that same health system to voluntarily report to the Decarbonization and Resilience Initiative. This gives the health systems who want to scale reporting across their hospitals an opportunity to join the initiative without needing to join the underlying team model itself, which is a bundled payment model. The second major element of the initiative, which I'll touch on just briefly, is the development and rollout of technical assistance and learning system support. So this could include support for activities such as accessing resources provided under the Inflation Reduction Act, compiling and disseminating best practices from facilities to successfully lower their emissions, and then identifying and disseminating tools to help facilities more accurately report their emissions data through the initiative itself. Just to close us out on this, I'd say we're excited about this initiative. And with this initial effort, we hope to collect data and information that will allow us to set a baseline understanding of greenhouse gas emissions and their impact on patients' health and program costs. So with that, I'll turn it back to Hardeep, I believe.
Great. Thank you, Michael. Thank you, Kevin. And thank you, Aparna. And thank you to your organizations that are leading this work, really in accelerating healthcare decarbonization. Okay, so now comes the fun part. We've heard from 3 organizations. Now we're going to do some question and answers. So the first thing that was sort of struck me is sort of the pros and cons between voluntary initiatives versus something that is more mandatory. And let's discuss, right? So what we learned in patient safety, at least, that's where I come from, is voluntary initiatives may not work when you need system transformation, which is sort of what we need here. But at the same time, health systems have competing priorities. So can we discuss? I want to hear your perspectives. I'm going to start with Michael because you just presented, and let's hear about sort of the tension between the mandatory and the voluntary, and what were your thoughts?
Yeah. So as I mentioned at the top, and I know you're referencing, our Decarbonization and Resilience Initiative is a voluntary initiative. We do have some incentives in place, but again, it's voluntary. So during the comment period, some urged us to make the initiative mandatory, but we ultimately landed on voluntary for a few reasons. One, I'd say this is a new area for many hospitals. And 2, it's also a new area for us at CMS and for us at the Innovation Center. And we felt voluntary gave us flexibility to adapt as both the center and hospitals continue to grow our understanding of how to best operate this initiative and ultimately reduce emissions. And I'd maybe add a few other things. So voluntary also allows us to build support for what we view as an extremely important effort. And I think it's really critical to build that support and buy-in. And we want to engage providers and hospitals in their decarbonization journey and understand that providers and hospitals are coming from different places. While some are already reporting some version of these data, others are far behind in their sustainability journey. And we have, for example, already heard from many hospitals that they just want to know where to start. And we think this initiative, plus the technical assistance we're providing, provides a good framework for getting started. And maybe the last thing I'd point to, is we have a lot of work to do on our end at CMS as well. That includes standing up this reporting system, analyzing the data, connecting it to our other data we collect. This is the first time CMS will ever receive this type of data. We also need to get the hospitals that opt into this initiative onboarded and ready to report. This first step adds a lot of value. And I'd say it also builds up our capability at CMS in this area, and it builds hospitals' capability in the area and prepares us to build on this work as we're ready and as we grow a little smarter in the area.
Thanks, Michael. So it looks like you're building the foundation. There's more to come. What about others? Who else wants to chime in? Kevin?
I can hop in here. So I agree a lot with what Michael was saying, and obviously the Joint Commission's Sustainable Healthcare Certification is voluntary as well. And I think there really does need to be a balance between the two of this voluntary and mandatory state. Some of the obvious pros for voluntary programs really include that flexibility to make decisions tailored to your own organization, staff, and patient communities, and then also that sense of autonomy in making decisions. So you have a better feeling of buy-in and engagement versus maybe that pressure to meet mandatory requirements. However, on the other hand, so when we're looking at the cons of a voluntary program, you can also look at inconsistent implementation. So without standardized metrics and requirements, some organizations are left without that guidance and framework to move towards an overall goal of decarbonization and increase sustainability initiatives. In addition, I think, like we mentioned, this kind of leads to that lack of urgency. So individuals and organizations don't feel that pressure to meet all the requirements at once, maybe leading to delay in initiatives or not acting on them altogether. When I think through mandatory programs, the main pros that really come to mind are that standardization. You're going to hear me probably discuss this consistently, but I think that in order to be moving together as one community, we need to be using standardized metrics, measures to really accurately benchmark and track progress as a sector. Another pro really is that accelerated action. So obviously, in the voluntary space, I mentioned that there's that potential lack of urgency. While on the opposite side, if you make something mandatory, that urgency is definitely ramped up. And then obviously that kind of just being held accountable to these metrics. Then when I'm thinking like the cons, it's the resource strain. So by implementing something mandatory right away, you can sometimes place organizations in a disadvantaged position, really leading to maybe a hindered view of sustainability and decarbonization from leadership teams by just maybe not being able to achieve those certain goals or outcomes right away. I think this leads to another con, which is the fact that mandates are typically made with the one-size-fits-all approach, and just they might not account for the unique circumstances of different organizations throughout the country. At the end of the day, I just think there needs to be a balance between the two that really includes a phased implementation approach. So starting with voluntary initiatives and then maybe transitioning to that mandatory standard, really allowing organizations to prepare and adapt to the transition. Providing support and resources, I think that's a critical piece that we're, as we all work together as a collective sector, we need that in place. And then finally, stakeholder engagement. So involving healthcare organizations in the development of policies and requirements really provides the necessary buy-in and feedback to develop this type of framework. So thank you.
Kevin, very good rationale here. Aparna, do you want to reflect on this as well?
I think that was actually really well said. So I don't have too much to add, but I do think I just want to kind of pull out a couple things Kevin said and underscore them. This idea that when there is variability in the pace of implementation of some of these standards, the benchmarking piece is really important, because I think the more kind of collective agreement and sort of at pace we have across the sector, the better that kind of like measurement and benchmarking gets, and that's really helpful. And also that many aspects of sustainability and decarbonization are benefited in the sector when there's collective action, like when we're moving markets, around more sustainable supply chains, and those kinds of things, where we may be, in regionally having an impact on energy markets and the availability and pricing of energy, and also certain products that we are that we want to sort of collectively commit to. And so I think having that collective action at pace there is a benefit there, but I think kind of the pros and cons, as both Michael and Kevin have laid them out, I think are really that was really well stated.
Thanks, Aparna. So Aparna, you talking about sort of adapting, moving in the right direction. You mentioned resilience. I mean, we need to do both, seems like, right? We need to do decarbonization to reduce pollution, reduce waste, but we also need to adapt because we're facing climate threats, and we need to adapt quickly. What are your thoughts on, is there a tension between the two? Do people feel like, doing one versus the other? What do you think?
Yeah, I mean, sorry, go ahead, Hardeep.
No, I mean, I want to hear your perspectives on.
Yeah, I think that oftentimes those two topics are understood as being sort of separate, like they're two parallel lanes. But I think it's really important to understand the relationship between decarbonization and resilience, how they can interplay, and maybe there are some examples where there are choices to be made around resilience investments where there is a tension and we have to adjudicate those. But I think what I want to focus on is how decarbonization can really support improved resilience. And I think, as we've all seen just unfolding before our eyes, but also statistically, this increased incidence of severe extreme weather events and climate-related disasters, the changes in geographic and temporal distribution of those events that have really stressed healthcare delivery. We know how costly those disruptions can be. We've seen some stories of disrupted supply chains, flooded facilities, and those are extremely costly to healthcare organizations and also threaten the health of the people that we serve. So certainly the imperative to think about resilience in a prospective and a forward and kind of outward-looking way in the setting of climate change is really important. And I think it's important to understand that decarbonization initiatives can increase our resilience. So I'll give you just a few examples. Some of the recent climate-related disasters and events that we've witnessed have caused power outages, grid disruptions. So we know that renewable energy and battery storage can be one strategy to increase our resilience to grid disruptions. And sort of kind of globally, if we're talking about emissions reduction and the fact that reduction initiatives and the fact that those can decrease our operating expenses in healthcare, that kind of is inherently a resilience promoting initiative. If we can operate more efficiently, we have more resources to invest in patient-facing programs, invest in staff, to shore up for those rainy days. So emissions reduction, efficiency, reduction in operating costs, and then therefore resiliency really do go hand in hand. So, and then I think also when we think about sustainable and resilient supply chains, those can also go hand in hand as well. So I think there are just a lot of ways in which emissions reduction, saving resources, and resilience are very intertwined. And I think it's important that we understand that relationship so that we're not sort of artificially separating the two. And I also think it can be like a language barrier for people where they think, okay, well, my lane is in resilience and preparedness. It's not decarbonization. But in fact, we have to understand that those two topics are intertwined. I wonder if either Kevin or Michael might have more to say about that. Kevin?
Yeah, I can definitely go. So thank you. Agree with a lot of what you're saying, Aparna. From my standpoint, there is definitely that mutual reinforcement between resilience and decarbonization. I mean, effective decarbonization strategies just enhance resilience. For example, implementing energy efficiency projects or transitioning to renewable energy sources not only reduces emissions, but also decreases that dependence on fossil fuels, making a facility less vulnerable to things like price fluctuations, supply disruptions, things like that. Also thinking through sustainable practices like green infrastructure, including urban forests or public green spaces or even permeable pavements, can really improve community resilience to more frequent natural disasters like flooding, heat waves, while also contributing to lower carbon emissions. I think one of the perceived tensions between resilience and decarbonization is probably resource allocation, and how/where do you place investment limited dollars at times. However, I think by finding balance, using holistic planning to really develop strategies that simultaneously address decarbonization and resilience, you're more likely to be set up for success. And then, finally, I would say that using adaptive management is important too. So implement flexible strategies that can really evolve on new information and changing conditions, allowing for just the adjustments as both climate impacts and technological solutions develop too. Michael, I don't know if you had anything else you wanted to mention.
Yeah, maybe just briefly. One, I'd say I totally agree with Aparna and Kevin that these efforts are not mutually exclusive. For CMMI, I think why you've seen us use the decarbonization language much more is we tried to take a step back and think about where we could add the most value. And our colleagues at CCSQ and the office that manages states and various participants have done a lot of work on resilience, as have many in this room, but an area CMS had not waded into yet was this actual emissions reporting. And we felt that's where we can make a unique impact and jumpstart the conversation around healthcare regulators' role in collecting this data. And so I guess what I'd point to there is that we're also working closely with our other components in CMS and other parts of HHS, such as OCHI right here, but also CDC and others, so we can really try to amplify their work to our model participants, which are hospitals and providers, and then potentially add elements to our initiatives that promotes this greater resilience, points to the connection between decarbonization and resilience. And I think that's really where that TA and learning system portion of our work comes in.
Yeah, thanks, Michael. All right, so let's move to one of my sort of favorite topics. I come from a quality safety background, and many of us have tried to make the case that environmental sustainability and decarbonization initiatives should be deeply embedded within the health system, normalized within quality. So, Kevin, I'm going to start with you because Joint Commission has been at this for decades, as you said. How do we make this a part of the quality agenda?
Yeah, so I mean, sustainability provides healthcare organizations the opportunity to become climate resilient, by optimizing the resources needed to provide safe, quality care. Healthcare organizations are really given the best possible ability to successfully manage the impact of climate change and improve patient outcomes. I think we all know this, but climate change disproportionately affects marginalized communities throughout the world. This includes health risks like increased cases of asthma and extreme temperature-related deaths. In addition, I think, as we start to see changes in climate patterns, there are many regions that are and will be experiencing food and water insecurities. We want to ensure that all communities have equitable access to a healthy, sustainable, and resilient environment. That's why at the end of the day, sustainable healthcare is a health equity and patient safety issue. We know that this is an overall health issue because if we support really the health of our planet, we're also contributing to the health of the communities that we serve. By reducing emissions, improving air quality, and decreasing waste disposal, healthcare organizations really create healthier environments for those nearest to them. At the end of the day, environmental sustainability is looking to meet the needs of the present without hindering the needs of future generations. And in healthcare, I think that's meeting the needs of our current patients without hindering the health of future generations. The effects of climate change go beyond borders. It is important that all healthcare organizations have access to the tools that promote sustainability. Our goal of this sustainable healthcare certification was really to enable organizations to implement practices that effectively adapt to the impacts of climate events, ensuring continuity of care and supporting recovery efforts within affected communities. One of the main pillars that I mentioned earlier was leadership. And I think a big piece of leadership is to start to develop and implement formal sustainability governance structures throughout an organization. By implementing cross-departmental, interdisciplinary teams that include quality improvement, environmental health, and clinical staff, to really tackle these challenges, I think you can start to build out that internal culture of change. Also, this could provide a pathway to internally integrate sustainability goals, decarbonization goals within quality improvement projects, ensuring that decarbonization becomes a standard consideration really in all initiatives. And then leveraging data analytics to track the impact of decarbonization initiatives on quality metrics can really help demonstrate the tangible benefits of sustainability efforts and justify further investment. You know, at the end of the day, though, it all goes back to collaboration across the sector and finding ways that we can all work together to support this important mission. So thank you.
Thanks, Kevin. Great points there. Anybody else wants to add?
Yeah, I may jump in. So, and forgive me if this is too technical, but I'd say another obvious area would be thinking about incorporation of select priority improvement activities to the Medicare MIPS value pathways, and just how Medicare thinks about quality payment overall. So for background, MVPs are subsets of measures and activities that are relevant to a specific specialty, condition, or patient population. And they include quality measures and improvement activities and cost measures. And the merit-based incentive payment system, or MIPS, is one way that CMS adjusts payments for providers based on their performance. And I think decarbonization actually, can fit very nicely within that framework. And I think one misconception is, perhaps that CMS does not have a role to play here, but a lot of the dollars flow from CMS to hospitals and providers. And one of those mechanisms is through the IPPS, where we make capital and operating payments. And to me and us, it makes perfect sense if we're paying for activities and infrastructure and buildings that produce emissions and have an impact on patient health. We have a vested interest in monitoring what that impact actually is on patient health. And we have all sorts of quality improvement and cost savings programs. And I think our decarbonization effort, again, actually does fit quite nicely within that framework.
Thanks, Michael. Aparna?
Just really briefly, I agree with all of everything that's been said. And I think, we talked about language kind of being important as we think about the relationship between decarbonization and resilience. I think the same is true here. I think the language of quality and safety is really important to engage clinicians and healthcare leadership in healthcare sustainability efforts. And, one of the things that we talk about a lot is the relationship between high value care and sustainability. And I think that's something that really resonates with important stakeholders in healthcare, especially clinicians. And, we often say that the greenest healthcare is the healthcare you don't need. And if there's a low value intervention, the greenest thing we can do is to avoid those low value interventions. So there's a lot of alignment between high value care from a clinical perspective and sustainability as well.
Great point, Aparna. And nearly 30% of care could be potentially low value. So there's a lot of room there to improve. And somebody has a comment about, single-use plastics, for instance. That's a lot of waste that we do in healthcare that we need to sort of tackle.
Yeah. Sorry, Hardeep, go ahead.
No, a lot of these plastics come from fossil fuels, which is another reason to sort of think about plastic waste, because we certainly throw away a lot. Yeah, go ahead.
I didn't mean to cut you off. I just got excited because that percentage is about the same percentage of energy that's wasted in an average American commercial building. So there's a lot of waste that is costly that we're talking about removing from the system, which has some of these kind of multiple wins, including wins related to quality and safety.
Yeah, great. Thank you. So I'm noticing the time, and we have probably just 1 or 2 minutes left. Any closing thoughts from my panelists? This has been a fantastic discussion. Either a myth that you want to dispel or a takeaway message that you want to give in the final, 1.5 minutes. Just about 20 seconds each, please. We'll start with Kevin.
Again, I just want to reiterate the collaboration across the industry is key to, honestly, the success of us all moving forward. I think partnerships and collaboration is something that we're all going to need to utilize together to achieve these goals. Thank you all. Appreciate it.
Michael?
Yep. So I think you've maybe noticed I've reiterated this a few times, but we do really want to reiterate CMS's role to play here, and particularly the CMS Innovation Center, we know that emissions have this impact on quality and cost. And, you know, as part of our role, we're here to think about innovative ways to address that and think comprehensively. And we monitor all of our models for these health, safety, and cost impacts, and decarbonization, we believe, fits very nicely within that framework as well.
Thanks, Michael, for your closing comments. Aparna?
Thank you. I also want to co-sign the importance of partnerships across HHS beyond and to our non-federal partners. And to just add one additional point that I don't think we've raised, which is coming out of the COVID-19 pandemic, a couple of common challenges that healthcare organizations are grappling with, we hear about it all the time, are razor-thin operating margins and concerns about staff burnout. And the topics that we're discussing here today and in this series get at both of those really core issues. Shoring up operating margins through some of these efficiency measures, and this issue around staff well-being. As some of you may know, there have been some recent surveys of clinicians across the country showing that a strong majority of clinicians across disciplines are want their employers, their healthcare employers, to be acting on climate. They understand climate smart healthcare delivery to be aligned with our mission as healthcare providers. And I think that that dimension of sort of recruitment, retention, and staff satisfaction is a really important value of these efforts as well.
Thanks, Aparna. And most of all, I think the patients are going to be asking us about this very soon.
Absolutely.
Not just clinicians and other staff members. Well, there's a lot of resources. There's a lot more to come. Please stay tuned because there's more webinars on the way that will go into deeper details. This is our introductory webinar that I hope that has set the stage for all of you to come back and listen to more. And then we're going to be putting some resources out there as well. Thank you so much for joining us today.